Good morning, everyone. I am Dr. Josephine Ramos, a pulmonologist at the Medical City. I am the current head of the lung cancer screening program at the Augusto P. Sarmiento Cancer Institute of the same institution. This morning, we shall be talking about lung cancer and the importance of screening and its early detection. November is Lung Cancer Awareness Month, and we would like to take this opportunity to share with you updated information on lung cancer. We should still be concerned about lung cancer because its threat is real. So let me take some time to tell you what lung cancer is about and why it is important to know these facts. Cancer is a disease in which cells in the body grow out of control. When cancer starts in the lungs, it is called lung cancer. Lung cancer may spread to other parts of the body, such as the brain, liver, and bones of the spine. When cancer cells spread to other organs, they are called metastases. There are two types of lung cancer: small cell, non-small cell, which includes adenocarcinoma and squamous cell carcinoma. These types of lung cancer grow differently and are treated differently. Non-small cell cancer is more common than small cell cancer. What is the impact or burden of lung cancer? This graph shows that in the whole world, more than half of the cases of lung cancer among males and females are in Asia, where we are. This next graph shows that more than half of the deaths from lung cancer is also from Asia. In the Philippines, lung cancer is the second most common cancer next to breast cancer. Take note, this graph shows that lung cancer is the most common cause of death among all cancers among Filipinos. In 2020, 17,063 lung cancer-related deaths were recorded in the Philippines. Just that year, and to give you an idea of how much it costs to have treatment for lung cancer treatment using therapies available costs a staggering $3 million to $4.1 million annually. Another observation that we doctors have and are looking at now is that for more than 20 years, the number of lung cancer in women has increased by more than 5% each year. Soon, it will become the most deadly cancer in women, exceeding the number of breast cancers. So we really need to do something more and fast to prevent lung cancer. So what causes lung cancer? Cigarette or tobacco smoking is still the top culprit as a cause of lung cancer. Cigarette or tobacco products, particularly its smoke, contain toxic compounds including cyanide, ammonia, butane, and formalin. People who smoke cigarettes are 15 to 30 times more likely to get lung cancer or die from lung cancer than people who do not smoke. At the Medical City, around 87% of our lung cancer cases was caused by smoking. WHO said about 71% of lung cancer deaths worldwide are caused by tobacco use. So what is it in cigarettes or tobacco? Tobacco smoke contains thousands of chemicals, some of which are toxic compounds, and quite a number can cause cancer, such as nicotine, arsenic, acetic acid, cyanide, butane, ammonia, and formalin. If you notice that these chemicals are what we use for cleaning, for battery making, and for preserving dead bodies like formalin. There are other risk factors that cause lung cancer. They are secondhand smoking, Persons who inhale the smoke of cigarettes or tobacco of another person may be prone to developing lung cancer. Constant exposure to radon, for example, those who live in houses with basements, may be a risk factor for lung cancer. Asbestos, which is a common industrial exposure among our patients who work in factories, may also lead to lung cancer. We know very well that air pollution is a constant problem in the Philippines, and it's a risk factor for cancer. Patients with chronic obstructive pulmonary disease or COPD, those with previous infections with tuberculosis, and those with genetic dispositions may develop lung cancer. Women who don't smoke, mostly of Asian descent, were also found to have higher chances of having lung cancer, based on a study called Female Asian Non-Smokers or FAN. The risk factors attributed were secondhand smoking. These women might have a strong family history of lung cancer. They may be using wood for cooking and may have developed oncogenic mutation involving EGFR, which is detected through a blood test. What are the common symptoms for us to suspect lung cancer? The common symptoms that may lead us to thinking or suspecting that the patient has lung cancer are the following: coughing that gets worse or doesn't go away, ubo na nagtatagal at lumalala habang tumatagal, chest pain, pananakit sa dibdib, shortness of breath, hapo or hingal, wheezing, humuhuni sa paghinga, coughing up blood, pag-ubo ng may dugo, feeling very tired all the time, panghihina, or weight loss with no known cause, pangangayayat, repeated pneumonia or lung infection, paulit na infection sa baga. Do not hesitate to see a doctor if any one of these are observed, because they are common symptoms of other diseases also. So let your doctor find out where these symptoms might be coming from and might as well give you advice on what to do next. So what are the tests that are done to diagnose lung cancer? Your doctors might prescribe the following to confirm the suspicion that indeed a patient has lung cancer. They may request for a chest X-ray. It may reveal an abnormal mass or nodule in the lung. Chest CT scan may be requested. It can reveal small lesions not seen on ordinary chest X-ray. If the patient is coughing with enough sputum, the sputum may be analyzed and studied under the microscope and may show cancer cells. Biopsy of a tissue may be needed to confirm the diagnosis. To know whether the lung cancer has spread or its extent, the following may be done or ordered by your doctor: a chest CT scan, a magnetic resonance imaging, which is MRI, or positive emission tomography or PET scan. These tests can help the doctors determine the extent of the cancer and puts the patient in the proper stage. Proper staging will help the doctor determine the appropriate treatment that should be offered to the patient. So lung cancer comes in 4 stages. We consider stage 1 and stage 2 as the early stages. Stage 1 lung cancer means that the lung cancer is localized or confined in one lung only. Stage 2 lung cancer is when the lung cancer nodule has grew in size and has spread to nearby lymph nodes in the same lung. The later stages of lung cancer are stages 3 and stage 4. Stage 3 cancer has spread from the lung and lymph node to other major structures in the chest. So in this graph, you would know that it has extended to the trachea and beyond the lung. Stage 4 cancer, however, has already metastasized to both lungs and to other parts of the body like the liver, brain, or bones, especially the spine. So are there options available for patients who are diagnosed with lung cancer? Yes, there are treatment options available now, such as targeted therapy. These are treatments that block the growth and spread of cancer cells. We can also offer chemotherapy. These are drugs or special medicines that shrink the size or kill the cancer cells. Another one is radiotherapy, wherein high energy rays are used to kill cancer cells. Surgery is when the surgeons remove the particular part with the cancer tissue. Immunotherapy is the newest kind of therapy where the drugs trigger the immune system to destroy the cancer cells and has minimal effects on normal cells, unlike chemotherapy. And it promises improved survival rate and better quality of life for the patient because they have less side effects. So, how can we prevent lung cancer? It is best for us to know how to prevent lung cancer because it is preventable. The first is never smoke cigarettes or tobacco products. If someone is already smoking, he is advised to quit immediately. For non-smokers, we are advised to avoid second-hand smoking inhalation. Again. So how can we prevent lung cancer? We should prevent lung cancer because it is a preventable type of cancer. The first thing that we advise our patients is never to start smoking cigarettes or tobacco products. If the patient is a smoker, he is advised to quit immediately. We advise patients to avoid secondhand smoke, to avoid air pollution as much as possible, and for persons who work in factories or industrial places, they are advised to wear the appropriate protective equipment at work, such as respirators or face masks. So the best way to prevent lung cancer is actually taking care of your lungs. So here are several steps that you can take care of your lungs well. And it includes quit smoking, avoid secondhand smoke like we mentioned, having regular checkup with your physicians, doing deep breathing exercises regularly, of course, eating the right food, and limiting your exposure to pollutants, and improving indoor air pollution by putting air purifying plants and devices. So these are the tips that the doctors usually will give you on how you should take care of your lungs. Drink a lot of fluids because the lungs that are well hydrated will less likely get sick. Eat more of vegetables and fruits. Have enough rest and sleep. Do you know that proper posture can promote good breathing? Yes. So observe proper posture and avoid slouching because your lungs are not expanding very well when you are in a slouch position. Please see your doctors regularly and do not be afraid to see your doctors because they can help you a lot and they are your partners in your treatment. Are advised to have regular vaccinations for flu and pneumonia to avoid infections. And check up with your doctor, especially if you notice something new, because these might be early symptoms of any lung disease. So, can lung cancer be detected early? We already learned that lung cancer can be prevented by taking good care of the lungs, principally by not smoking and many more ways. Among patients who just cannot quit smoking immediately, they can avail of smoking cessation programs to assist them with quitting. For those who are still smoking or have just recently quit, the risk for having lung cancer remains high. Yes, the doctors can now detect lung cancer early. It is important to discover the tumor early so that the rate of cure is higher while the lesion is still small and has not spread to other parts of the body, and the patient may not be feeling sick with symptoms, so they will be able to tolerate the procedures that may be performed. So, unfortunately, an ordinary chest X-ray may not detect all the time lung nodules which are rather small. What is screening? Screening tests are procedures done on a regular basis to persons at risk for cancer with the aim of detecting new lesions or nodules as early as possible in its stage. Tests are being done among women to screen for breast cancer, men for prostate cancer, and tests for colon cancer for both men and women. Based on studies in the United States and in Europe, the screening procedure for lung cancer has been found to detect early cancer in 20% of those who were screened, which led to early treatment and possible cure. The screening procedure that we recommend is doing a low-dose computed tomography, also called a low-dose CT scan. This CT scan will not use a contrast dye, so there will be no injections, and this procedure is usually very easy, and the patient will complete its test in just 15 minutes. An X-ray machine uses a low amount of radiation to make detailed images of a person's lung. During the procedure, the patient is lying down comfortably on the CT scan machine. The doctors then will discuss with the patient and his family who will undergo the procedure and what else to expect before, during, and during the procedure. So, what are the criteria that you use to recommend screening? The U.S. Preventive Services Task Force recommends yearly lung cancer screening with low-dose chest CT scan for people who are 20-pack-year smokers or has a significant smoking history. 20-pack-year smoking means that the person has smoked a pack of cigarettes every day for a total of 20 years. So if a person has smoked only half a pack of cigarettes for 20 years, his pack years is computed as 10, which is 20 years divided by half of pack or 5 to give 10 smoking years. If the patient has not completely quit smoking within 15 years, they are also recommended to have the screening. And we start screening our patients at the age of 50, and we can say that we can stop screening patients who are more than 80 years old. So, additional criteria that may be considered to recommend screening is based on recent studies in Taiwan with Taiwanese patients, where they found that even those who do not smoke are at risk for lung cancer. So these are those who are second-hand smokers, those with family history of lung cancer, like an immediate family member has lung cancer, we suggest that they be screened. They have prior TB infections, those who have been cooking with biomass, especially for those who are living in the provinces, and if by history taking, the patient might have some genetic mutation. So, screening is stopped when the patient turns 81 years old or the patient has successfully stopped smoking for more than 15 years, or the patient unfortunately develops a health problem that will make him unwilling or unable to have surgery if ever lung cancer is found. Here at the Medical City, we started our lung cancer screening program with our TMC staff and employees. At the Medical City Lung Cancer Screening Program of the Lung Cancer Clinic, all patients are assessed as to their eligibility for lung cancer screening. So assessment starts with taking a good history of their medical, personal, and family histories, a good physical exam, and then questions whether these patients have any of the risk factors will determine their eligibility for screening. Patients who are found to be eligible for screening are then advised to undergo low-dose chest CT scan. Here at Medical City, it's important that doctors would explain to the patient and their families. So we suggest that they be seen by a pulmonologist to explain the risks and benefits of doing a low-dose chest CT scan, and so they may be advised as to what the results may tell them. The take-home messages that I would like to emphasize with you now are: lung cancer is the most deadly cancer among Filipinos. Lung cancer can be prevented. It can be detected in its early stage. Low-dose chest CT scan is the recommended screening procedure that will detect a small lesion in the lung. Treatment success is higher when lung cancer is seen in its early stage and when the lesion is small. And finally, seek your doctor's advice, especially if you have new symptoms pertaining to lung health. Thank you very much for listening.